There's been anger amongst health officials in the UK after the former Health Secretary claimed patients should be charged for GP visits and trips to the emergency room. The claims from Sajid Javid have prompted widespread calls for a revamp of the NHS.
Are you coughing anything up at the moment?
No.
Nothing at all, so
No.
it's a dry cough.
Yeah, but right here.
As a motivational speaker, Nigel Reisner relies on his voice and is constantly travelling. A chest pain meant the 60-year-old needed a quick prognosis, which an NHS GP couldn't provide.
I've got a chest infection, and I knew I'd have to call the doctor. You've got to make sure you're on the phone at 8 o'clock exact, and I was number 31 in line. Well, I'm not waiting for 3.5 hours, and eventually I got through to be told I've got to wait for someone to call me back so I can explain to them what the process is, and the earliest will be the 21st of February.
A consultation at this private surgery in North London costs up to £100. The doctor in charge does not believe paying to see a GP should be the norm, as former Health Secretary Sajid Javid is proposing, along with charging for A&E visits.
Okay. GPs are seeing bigger problems, things that have been held on to for too long. In the end, that's going to cost the NHS much, much more money. We need to look at the whole system. Who's going to do the administration for these charges? Are we going to turn patients away who don't have money? We need to get to the core of what is going on across all party discussion and get the patients seen.
Mr Javid wrote in The Times, "We should look on a cross-party basis at extending the contributory principle. This conversation will not be easy, but it can help the NHS ration its finite supply more effectively." Emulating Ireland's charges, he wants to build on a vision set out recently on Sky News to relieve the burden on the NHS.
Having worked up close now with the health service, and I don't think the model of the NHS as it was set up some 70 years ago is sustainable for the future. The world has changed and the NHS has not moved on.
You've got a lot of information going on in your lungs.
While Mr Javid wants a mean-tested scheme to protect those on low incomes, critics fear healthcare would become less accessible for people in need of quick treatment.
Fast, effective, speedy intervention is really, really important. So what we'd see is, I think, people getting delayed care, their health outcomes as a result, their probability of dying avoidably becoming much worse, much higher, and of course the impact that the health condition, if it's progressed, then has on their wider life, that being much more severe as well.
Downing Street says Sajid Javid's proposals are not currently being considered. But for patients like Nigel Reisner, a speedy diagnosis only comes from paying for a GP rather than waiting for an appointment on a stretched NHS.
You all right?